Hello, my name is Dr. Chancy Marsh. I'm a chartered clinical psychologist and a psychodynamic psychotherapist. My colleagues at Counselling Directory have asked me to record this short video for you today to talk a little bit about emotionally unstable personality disorder, or what used to be called borderline personality disorder. First of all, I just want to address that term. It's quite controversial. And I think in a few years' time, we will all start to talk about these particular collection of difficulties as a trauma response, complex trauma, complex needs. I think that's really important to start off with. Now, what is it? Emotionally unstable personality disorder. Sounds quite frightening. I think that as a diagnosis, it's really loaded, quite emotionally loaded as well. Of course, we all have a personality, and to be told that our personality is disordered is somewhat, I think, alarming for people. What we are talking about is a collection of difficulties that mean that life is really difficult to experience, actually. I want to go through a few of the symptoms so that you can get an idea of what I'm talking about here. Somebody with complex needs may find it really hard to control emotions. They may feel very happy, very sad, very angry, very scared, quite quickly, actually. Somebody with these collection of difficulties may really struggle, actually, in relationships. They may form relationships really quickly, but they may lose them just as quick. Relationships may feel intense and unstable. People can feel quite paranoid, actually, abandoned in relationships, quite low, perhaps, when things don't always work out. There can be a chronic sense of feeling empty, very lonely, feel very bad about oneself, actually, and that in itself is a very difficult experience to manage. There may be impulsive behaviour, perhaps spending, perhaps sex, perhaps self-harm, perhaps drug taking, perhaps alcohol. All of those ways are an attempt to manage the difficult feelings. We know that mood is really unstable for people with these experiences, and so those impulsive ways of managing, I think, are an attempt to try and deal actually with feelings that are just too big. As you can imagine, living with those symptoms is incredibly difficult at times, but of course it's really important that I say that this is treatable. This is a diagnosis that can be made better for people. I think for a long time that's not always seemed to be the case. Without a full individual assessment, it's very difficult to say specifically how any individual came to develop complex needs. But I do think it's important really to talk generically about causes. What we do know is that people are not born with these difficulties, so this is not organic. There are, of course, some genetic loaders, predisposition to stress, for example. But I kind of want to give you an analogy of a cake, something where there are lots of contributing factors that leads to a final product. The final product here, of course, being the development of complex needs. For me, there are a few key ingredients that go into this recipe. First of all, there's something called epigenetics, which is a baby's experience of being in the womb. I'll give you an example. If I was pregnant right now, perhaps I was in an abusive relationship, perhaps I was suffering from a bereavement, perhaps I had my own mental health difficulties. Naturally, my stress levels would be very high. My cortisol, adrenaline, neuroadrenaline would be really high as my baby was developing. Now, this doesn't mean that there is any damage per se to the baby that I'm carrying, but it would suggest that there is a contributing factor. Perhaps that my baby would be leaning towards a stressful response. If once I had this baby, I had difficult attaching, perhaps I had postnatal depression, perhaps I had many other children, perhaps I had to go back to work straight away, perhaps there was some kind of family traumatic event. Again, that on its own perhaps isn't going to lead to a negative outcome, but it could be another contributing factor. Perhaps there were difficult family experiences following this. Perhaps there was sexual abuse, perhaps there was neglect, perhaps there was emotional abuse, physical abuse perhaps. All of these things, again, add more contributing factors. Maybe as this child was growing up and at school, maybe there was bullying, maybe there were difficulties with peers. Maybe as this child developed, there would be teenage experiences that were very traumatic, very difficult for this teenager. Perhaps there wasn't adequate support emotionally around this teenager. Perhaps those difficulties extended into adulthood. Here we have the idea of a cake, lots of ingredients, lots of contributing factors. That means really at the end of adolescence, kind of 17, 18, 19 and into adulthood, these symptoms really start to be seen. Difficulty with mood, difficulty in relationships, perhaps maybe risky behaviour. All of these things are incredibly worrying for the individual and of course people around the individual. We like to think about mental health difficulties as the environmental impact. I think in this particular diagnosis it's incredibly important to do so. But again, an individual assessment will be able to look at what's going on for that particular person. So really things can be made sense out of. Now, I did say earlier that it was important to acknowledge that there was help for this diagnosis. There was help available for people who are really suffering from this collection of difficulties. Talking therapy is an amazing resource. I like to think about this particular diagnosis as being relational. There's such a relationship component to the struggles for somebody. So of course for me, therapy is a wonderful way to address some of those difficulties. Psychodynamic psychotherapy is a really great option for somebody. DBT, dialectical behavioural therapy, is skills-based strategies, really does help somebody create some space actually from an event happening and then reacting. It just creates a little bit of space to think, really. MBT is another relational type therapy, mentalization based therapy, and all three of those therapies are proven with lots of research to say that they can be very effective for individuals with complex needs. Of course, people's experiences will differ, but what we do know is that short-term therapy is ineffective. What we're looking at is a longer term therapy, a longer period of time where somebody can feel safe and develop a lot of trust in a therapeutic relationship. If you are somebody that really resonated with some of the things that I've spoken about today and feel ready to make contact with a therapist, you'll be able to find more details about this at my own website, the Sycamore Private Practice, or other colleagues that I have on the counselling directory. Please do get in touch and I wish you all the very best.